So lateral hip pain is what we thought we'd look at for this month's newsletter. Put a little video together to just run through some things that you might like to do to try to help with pain that you're getting coming over the side of your hip, into your buttock, maybe into the side of the leg a little. Getting your circulation going, a little bit of soft tissue release, and either one of the spiky or knobbly balls that we've got can be perfect for that. To start off with, probably in standing, just using the pressure of your own hand, small circles, working in and around the area where you feel your discomfort. So if that's coming along and over the side of the leg into the ITB, you can work down and along there. Might be uncomfortable as you do it, but it shouldn't be painful. Certainly shouldn't be causing any radiation coming down into the leg at all. If that's tolerable, you want a little bit more pressure, take the ball and maybe place it in between you and the wall. And then again, you can move your body so that you feel that pressure coming in over the back of that hip, over the side of the leg there. But you can apply that little bit more weight to get maybe a slightly deeper release into those soft tissue structures. Increasing it again, you could come down into lying, placing it in and again around the area where you feel that discomfort. You can gently rock side to side, maybe some pelvic tilts, or knees together and let those knees begin to move, feeling that on-off pressure in and over that back of the hip. Don't worry if you find you can't go quite as far one way as the other. Listen to your body and go as far as you feel comfortable. Once we've got that circulation increased using the spiky ball there, we can go into some stretches. And our hip twist level 2, feet together, arms spread wide, is a really nice way of, again, starting to increase the mobility in those structures over the lower back and over the side of the hip there, letting those knees gently move together. Maybe 5 times each way, and then starting to go into a little bit more stretching over the back of the hip. We can hug that knee in towards your chest, feeling that stretch coming into here. Now they're quite big structures, so we want to give them a chance to adapt and change. Looking at maybe holding for up to that 20 to 30 second stretch. Building up a little bit more, place the foot onto the opposite knee and start to turn the knee away to make that figure 4 shape there. And that will start to release a little bit more over the back of the hip, but also maybe into the groin a little as well. Again, they're big structures, so go to the edge of a stretch that you can tolerate holding for that 20 to 30 second hold. And we're looking at trying to do maybe 3 repetitions of those. If this isn't strong enough, the stretch, you want a little bit more, you can lift the supporting leg using your hands to help. Just give yourself that little bit more overpressure there. And the other direction that might help to release the side of the hip is to reach across and bring that knee across the body towards the opposite hip there. As long as you're not getting any pain into your groin and you feel the stretch coming over your buttock and along and into the side of the hip. So there's a few exercises, the little series that you could put together to allow yourself to try and get a bit more mobility in and around those glutes and hips.